Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.
Good morning, everyone, and welcome to the broadcast today. Experience Core is an intergenerational all-literacy program which has older adults as mentors and tutors for students in Cleveland schools. Project Director Deborah Kay is here to talk about the need for more volunteers and the relationship with the Cleveland Municipal School District or the Cleveland Metropolitan School District. Also today, Dr. Karen Ashby of University Hospitals of Cleveland and fitness coach John Henry Creel of Mind and Body Fitness will share with us the 5 things every woman should know to keep healthy. Also in the broadcast today, Lanice Bozeman and Dorothy Harris will talk about a community walk against breast cancer. Good morning again. I'm Leon Bibb. This is Kaleidoscope, and so we begin. Beginning with Deborah Kay, who's been with us before. She's Project Director of Experience Core, hosted by Greater Cleveland Volunteers. Good to see you, Deborah. Good morning. How are you?
I'm fine, thank you.
Tell me, what is it? What is it that Experience Core, hosted by Greater Cleveland Volunteers, what is that?
Experience Core is an intergenerational program, like you said, and we take older adults, 55 and up, and we train them extensively and put them in the role of tutor, tutoring young kids K through 3, and they teach them all the critical literacy skills.
All of that's needed. They use that experience that they have garnered
exactly
and
right.
gathered over generations.
Yes,
and
that's why it's called Experience Core.
What kind of programs and services? How do you go about doing that?
Well, we recruit heavily, obviously. We take our volunteers and we train them. We have an extensive training program. And our teachers, they recommend the kids that need it the most. And they're able to customize the most critical of the literacy skills that they need first, so that we can build on that, hopefully, to get them to read by they're in 4th grade.
Yeah, how many?
At their grade level.
Yeah, how many volunteers are we talking about?
We had this past year we had 250, and 40 of those were what we call our mentors that serve in the lunchtime mentoring program, and then the rest were the volunteers that work with the kids as tutors, and we served well over 1,000 kids this year.
And you're always looking for more people to volunteer and be tutors?
Yes, yes, definitely.
Yeah, we're going to put a phone number on the screen. People can call that number and get more information on everything we're talking about. By the way, that number is 391-9500 in the 216 area code, as you see at the bottom of the screen. What impact does this have on the lives of these youngsters in the Cleveland Metropolitan School District?
Well, as you know, the dropout rate is a critical issue with the school district, and the studies have shown that we hit them at the early age, get them up to reading proficiently by 4th grade, so that in 4th grade is the first year that they read to learn, where all the social studies and sciences are introduced. So if they don't know how to read, they're not going to be able to pick up vocabulary and so forth. So we want to do that, get them up to reading level.
Now, what grades again are you working with?
Kindergarten through 3rd.
K through 3rd, which are very crucial because you got that's that base, that foundation that we all need. How long has this been going on?
This was started in one form or another in 1997, and we've served well over 50,000 kids in those years in the Cleveland School District.
Yeah, are you working in all the schools?
No, right now we're in 14 of the schools. We will be expanding hopefully in the next few years, and the school district would like us to do that. We fit into their transformation plan because focus is on the early intervention, and we are rated the top level of a evidence-backed intervention program for literacy in the school district. So.
Yeah, what kind of volunteers are you looking for? What do they need to become volunteers with your organization to work with the kids?
All they need is a willingness to help children and help them learn how to read, and they should be able to read and write themselves, and that's all we ask.
Does it distress you that literacy is not as high as it should be in this country? Here in the 21st century, there are people youngsters who still do not read at the grade level they should be reading at. Does that distress you?
Yes, it does, and that's why we're here. We're introduced to a special report by the Casey Foundation that said on the National Assessment Academic Progress Report, which is 4th graders, 80% of the low-income children and 85% of high-poverty children fail to meet proficiency level in 4th grade. So there is where our fit is, kindergarten through 3rd.
So if these youngsters are in the pipeline and they're not reading where they should be reading, when they come out the pipeline at the end of their school career, they're going to have difficulty getting jobs.
That's right.
And the cycle continues again.
The dropout rate is really high, and right now kids are starting to drop out as early as 6th grade. They're not even waiting until high school.
Okay.
So this affects that.
You can find more information by dialing 391-9500. That's to the Experience Corps, hosted by the Greater Cleveland Volunteers. Or you can go to greaterclevelandvolunteers.org.
That's
more
correct.
information on everything that we've been talking about. Why do you do this, Deborah? You're the project director. What motivates you to keep going?
The children. The children. I direct the program, and I have wonderful people under me that manage the program in the schools. It's the children. You walk into a school and you see these young little lives that are, they're ready, they're hungry to learn, and we can help them achieve what they want in life by helping them build that solid reading foundation that they're going to need.
Mothers and dads in the children's homes can help a great deal too.
Yes.
That's the first teacher, right?
Yes, yes. And a lot of kids don't get what they need before they come into kindergarten, so they're not kindergarten ready. And so we pick up there and work with the most basic skills and then build on those.
So you're in your tutoring program, the heavy emphasis is on reading,
Yes.
writing and reading and writing and literacy.
Yes, literacy is the components that you need to know to become a reader. So there's 5 components.
Deborah Kay is the project director for the Experience Corps, hosted by the Greater Cleveland Volunteers. They've been around for some years now. You may telephone them at 216-391-9500, or you can go to greaterclevelandvolunteers.org. Right, Deborah?
That's right. And we also need mentors.
And that's why we're talking about it. We need mentors. We need people. So if you want to be a part of that, and you should be, then give a telephone call to 391-9500, get more information, and perhaps you can sign on the dotted line.
All right.
Thank you so much.
Thank you.
You may log on to Newsnet5.com to see what's coming up on Kaleidoscope. Coming up next, I've got 5 medical facts women need to know to stay healthy. I'm Leon Wood. Back in a moment. Welcome back to more of Kaleidoscope. Dr. Karen Ashby is an obstetrician gynecologist at University Hospitals of Cleveland, and John Henry Creel is a fitness coach at Mind and Body Fitness. And they are here to talk about obesity and how it impacts women's health. Dr. Ashby will also share 5 medical facts that all women need to know. Good to have you with us, Dr. Karen Ashby.
Thank you.
Good friend of mine. And John Henry Creel, good friend of mine, also my personal coach when it comes to building up muscle and all stuff like that. But good to have you with us here. We're talking really about obesity. Tell us, it is a growing problem in America,
It's a
isn't it?
huge problem. I mean, currently, there are approximately 1/3 of women are obese. And if you look at women of color, particularly minority women, African American and Hispanic women, you're talking about up to half in some populations. So it's a real problem.
And this has a direct impact on fertility,
Right.
miscarriages, giving birth,
Right.
things like that,
Right.
the area of the world that you work in.
Absolutely, absolutely. And we're starting to see obesity in a lot younger women. I mean, even teenagers and young children.
Yeah.
So it's a real problem.
John Henry Creel, you're the president and the owner of Mind and Body Fitness. What made you want to create this partnership with Dr. Karen Ashby to talk about obesity?
Well, Leon, thanks for having us again. And it's been my plight to just try to get people to understand weight management more, and like Karen said, try to do it as early as possible in life, because it's important. We can cut off a lot of health risk factors or reduce a lot if we just learn to take care of ourselves.
And build up some muscle,
And
build up some muscle and get rid of the fat.
Absolutely.
Okay. You are here to talk a little bit about those 5 things now.
Right.
And you're going to go through it rather quickly.
Right. Well, diabetes is one big issue. I mean, that's one of the things that, and because many of us have a family history, I mean, you can't always prevent it, but you can certainly modify some of your risk factors. And often it shows up when women are pregnant. I mean, that's a lot of times diabetes and high blood pressure show up during pregnancy. And if you have those conditions during pregnancy, you have a much higher risk of having it later in life.
Yeah. Hypertension gets to be a problem as well.
Hypertension, true. And many times women will, if they do have these conditions while they're pregnant, they may go away after the baby's born, you know, during the 6-week period, and then if they don't kind of lose the weight or modify some of the risk factors, then they can certainly come back or certainly persist.
Okay, let's bring in John Henry now. John Henry, as a fitness coach, what can you do to help in the things that we've been talking about here? Diabetes, hypertension, overweight.
Well, the best thing to do, you know, is try to control your blood sugar level, and that's what exercise and nutrition does. It's not just about moving around and what have you. There are specific ways to exercise and obviously specific ways to eat so we can control your blood sugar level, and then that's the best way to work your muscles and to decrease that body fat so it's in a healthy range.
A lot of people do not want to sweat. What do you tell them if they don't want to sweat?
Well, you know, sweating, you know, it's not just because somebody's sweating profusely doesn't mean it's the greatest thing ever. You know, it's just about what you feel and working your muscles.
So you've got to work those muscles to burn up the fat and get the weight down.
Absolutely.
And build up muscle.
Absolutely.
Okay. What are other things that we need to keep in mind?
Well, I mean, a lot of it's just getting care too, and talking about your provider. I mean, many times I see women that have, you know, they're seeing a physician and they never talk about their weight. I mean, it's not something that is brought up, and I think, you know, sometimes utilizing a nutritionist or, like I said, or seeing somebody like John Henry and coming up with a diet and exercise plan are very important, and they're good habits to establish. And I tell a lot of my patients that, you know, when you, especially if you have a daughter, I mean, you want to get your daughters into eating right and starting to exercise very early in life, because it's a lot easier to manage, like I said, when you're younger.
Yeah, they should call John Henry. By the way, let's put John Henry's phone number up on the screen, 216-464-6117, or you can go to mindandbodyfitness.com, mindandbodyfitness.com, or 216-464-6117. He's located in the community of Beechwood. 1/3 of American women are obese, and the rate is as high as 50% in women of color. Yeah. Speak to that, Karen.
That, I mean, it's a very alarming and a very real statistic, and I think if you look around, I mean, look around, you can see that it's a very real statistic. And I think, unfortunately, women, because we are so used to we're getting comfortable with seeing women that are overweight, so a lot of times women don't think they have a problem. I mean, one of the questions I ask women a lot of times is, well, what range do you think your weight should be in? And a lot of times they're 20 or 30 pounds off of what's appropriate for their height.
John Henry, you have people who come to your facility, Mind and Body Fitness in Beechwood, who have dealt with diabetes, have dealt with obesity. Have you been able to help them turn around their lives?
Unfortunately, I've had too many people that I have to work with over the years, Leon. But, you know, my main thing with people is to let them know it's not that difficult.
You can turn it around.
Absolutely. You know, people are overwhelmed, they're upset, they're a little bit, you know, unhappy with the way they feel and what have you. And my job, and that's why I work with Karen as much as we can, is to, you know, let people know that yes, there's a lot to do, and you may feel like it's, you know, you're behind a little bit, but the changes are really simple.
And this can help in pregnancies of women.
Absolutely. I mean, women that are obese when they start pregnancy, like I said, they have a higher rate of miscarriage. I mean, a lot of times if you're a larger woman and you're pregnant, you have a higher risk of having a bigger baby. And bigger babies are more complications with, you know, the actual delivery. So, I mean, and you can also exercise when you're pregnant. I think sometimes women don't appreciate that, you know, having a good exercise routine and a good diet when you're pregnant is also very helpful.
I've got 30 seconds remaining. Let's ask the $64,000 question. Do you yourself exercise?
Absolutely. Absolutely. I kind of feel that it's not right to be a physician if I'm telling people to do something I don't do. You know, everyone's busy. Everybody has a chaotic lifestyle, but you have to make the changes. And as John was saying, and sometimes I tell my patients, sometimes if you can just change one thing at a time, because people do get overwhelmed and they feel like they can't do everything.
And
so
John Henry will help you find the way to do it.
Absolutely.
John Henry's telephone number, by the way, John Henry Creel, a fitness coach of Mind and Body Fitness, 464-6117, as you see at the bottom of the screen. We've run out of time, but we're going to have you back.
Thank you.
We always will have you back. Thank you, Karen. Dr. Karen Ashby and John Henry Creel.
Always, sir.
Good to see you from Mind and Body Fitness. I'll take a break. We'll be right back. This is Kaleidoscope. Back after this. Welcome back to more of Kaleidoscope. Residents of the Mount Pleasant community on the southeast side of Cleveland will be walking on August the 28th to bring attention to an aggressive form of cancer found in women of color. It is called triple-negative breast cancer. and co-chair Lanice Bozeman and co-chair Dorothy Harris are here to talk more about this event, which is going to take place on Saturday, August the 28th. Good to have you with us, Lanice and Dorothy.
Thank you.
Tell me about the triple negative breast cancer. What is triple negative breast cancer?
Triple negative breast cancer, as you said, is a form of breast cancer most prevalent in women of color. And I've just been reading about it lately in terms of basically the cause is related to stress. It's been said that women who live in unsafe housing and crime areas are more likely to be detected of this form of cancer.
So we're going to have a walk. You're going to have a walk to bring attention to this, right, Lanice?
Yes.
Tell me about the walk.
Well, the walk is, it has two purposes. One is to bring unity in community that this time last year got a bad rap. They found those 11 victims. And so we wanted
the ones on Imperial Avenue.
Right. And so we wanted to do something positive because it was out there and it was like a bad rap. And we wanted to do something positive to show that the community can come together on a more positive note. And then while we gathered together, we wanted to teach them. Me being a 10-year breast cancer survivor myself, breast cancer is something that is near and dear because when I went through it, a lot of women didn't talk about it.
Right.
And so, they would do the commercials, and I would look at the commercial, but I didn't think that it concerned me. But as I was going through my treatments, a lot of women I met had mentioned that they had went through that, and I was like, well, why didn't you say anything? So it's lack of information to the peoples of the inner city, so we wanted to know that, you know, you might get it, but you can be a survivor.
You certainly can survive it, and there's certain, you need to know the symptoms, and you need to do the self-examinations. You begin with yourself, and certainly see doctors on a regular basis. But this walk is going to be Saturday, August the 28th, and you're going to start assembling at 7 o'clock in the morning, right?
Yes.
7 o'clock on Saturday, August the 28th. Where does the assembly take place now, Dorothy? Where are you going to be meeting?
In the parking lot of New Sardis Primitive Baptist Church. We're going to assemble there, and we're going to step off at 9:30.
Okay, and we should add that New Sardis Primitive Baptist Church is located at East 147th Street and Kinsman Road in Southeast Cleveland, right across the street from the brand new A.J. Rickoff School, part of the Cleveland school system. But at the New Sardis Primitive Baptist Church, East 147 and Kinsman Road in Southeast Cleveland. How do people get registered? What do they do to get registered now?
They can call either Providence Baptist Church at 991-5315, or they can call Mount Olive, which is Sister Harris Church.
Mount Olive Missionary Baptist Church. That number is 216-991-2830.
And we've got that number on the screen, 991-2830. If people make a phone call to that, they can get involved, registered.
Get information.
Can they also just show up?
Yes, that's another thing. We have vendors. If you're a vendor, you're welcome to be a vendor. We need volunteers to set up the breakdown. We ask the people to get the young youth in their church to be involved, you know, to get a drill team or a parade, because it's a walk/parade. We have Shaw Band and we getting other people to participate in the parade.
So it's really going to be a fun event. It's going to be educational on one end, but fun on the other end as well.
And the name also, Mr. Bibb, is catchy. It's called A Stroll for the Soul. How about that?
A Stroll for the Soul.
A Stroll for the Soul.
There used to be a dance we danced to many years ago called The Stroll. People will be strolling along Kinsman Road there. This is vital for you, isn't it, Dorothy? Why are you involved in this? What's the driving wheel to keep you involved?
You know, it started during the President Obama's election, and Soledad O'Brien did a special on triple negative breast cancer, and that was the first time I had heard of it. And the thing that really stood out with me is that as I would ask to different women about it or speak about it in public areas, they were blank. They knew nothing. And we had a Mother's Day luncheon this year at the embassy, and I was in a room with 500 ladies. And I made the announcement, and I asked who had heard about knew of triple negative breast cancer. Not a one lady raised her hand. So that said to me there was an urgency. If I was in a room with 500 women who knew nothing, we had to do something about that.
There is an urgency of it. I know a woman who died of triple negative breast cancer. But once again, it's going to be Saturday, August the 28th, and going to begin at New Sardis Primitive Baptist Church, East 147th and Kinsman. Starts at 9 o'clock, but registration and all that begins at 7 o'clock. Yes. You're going to step off at 9 o'clock. Lanice Bozeman and Dorothy Harris are chairs of it. They represent the Mount Pleasant Community Breast Cancer Walk.
I would like to also say that
quickly.
We accept sponsor. We have got Cleveland Clinic to be one of our sponsor, and we have the United Black Fund to be another sponsor. So we not only want people to register, but we do take donations too.
We'll be glad to get that point out.
Well, thank you.
You just got that point out too. We'll take a break. I'll be right back in just a moment. Hold on. Here is our good friend Marcia Maccabee of the Urban League of Greater Cleveland. She's always here with words that inspire us on every Kaleidoscope. Good to see you, Marcia.
It's good to see you too, Leon. How are you today?
I'm okay.
Good. Listen, today I just want to talk a little bit about a program that we've been doing at the Urban League. Again, just a follow-up where we've been working with a special group of youth leaders who have been helping us at the Urban League with community service, and they've been learning all kinds of leadership skills and so forth, and a few of them have just gone to our youth conference component of the National Urban League Conference. So they've had a great opportunity there and a great event, learned many things. And I think what it just really sparked for me is that we really have to invest in the leadership development of our youth, because they're that next generation who are going to step up and who are going to take leadership and who are going to keep the course of this great country of ours going forward.
So we've got to make sure that the leaders are, that the young people coming up, that the baton is handed to them, and that they're able to run in the race.
Absolutely. And to that end, I'm very excited that we're going to be reinvigorating our Young Professionals organization. I have a group of about 10 to 12 young people who are or young professionals in that like 30 age range, 30 to 40, who are just on fire to really do some things in this city, and they've been meeting with me, and we're going to be convening very soon to really set the landmark and set the pace to start our Young Professionals organization again.
Thank you so much, Marcia.
Thank you.
You always inspire us. We appreciate that.
Thank you.
We both will say so long.
Kaleidoscope, a weekly public affairs program brought to you in partnership with the Urban League of Greater Cleveland, Kaleidoscope Magazine, and News Channel 5.